To Liz and Jane from Palliative Care Australia, thank you very much again for hosting us here in Parliament House in Palliative Care Week. It is very good to be with you again. At this event last year, I said that Palliative Care Week was one of the more difficult annual events, but also one of the most important. None of us like to think about being diagnosed with an incurable disease or dwell on how we will spend our final weeks and months. I suspected but didn't know for sure at the time, but my own family was shortly to embark a few months later on our own very difficult and fairly traumatic palliative care journey. But I also said that Palliative Care Week was vital because it is an annual opportunity to highlight the critical role that palliative care can play at the end of our lives and to advocate for better access. Because the hard truth is we are not dying well. Most Australians, up to 70% of us, express a wish to die at home, surrounded by family and friends. But very few of us get to do that. Only 14% of Australians die at home, half as many as similar countries, and access to palliative care in all of those settings is limited. The strain on our system will only increase in the years ahead. Around 150,000 Australians die every year, and our ageing population means that number will double in the next 25 years. Not all people will need or want palliative care. Not will all want it in community settings. Today I want to highlight two roles that I think the Commonwealth in particular can play. First, we should invest in making palliative care available to more Australians across all settings. At this lunch a year ago, I was very proud to announce a $35 million commitment from Labor to improve access to palliative care. Of course, Labor did not get the opportunity to govern, but our commitment would have made palliative care at home packages available to an additional 4,000 Australians. It would have funded new models of palliative care between hospitals and residential aged care, a model that has been very successful here in the ACT with Clare Holland House. And it would have invested specifically in paediatric palliative care because children and families who are in that unthinkable position deserve the best possible care and support. Our commitment was, of course, only a first step, but it would have been a meaningful and important one. I do want to acknowledge that the recent budget included a commitment of $8 million to palliative care. I welcome that, and we look forward to seeing the detail of the measure. And of course, any further investments that the government makes in palliative care will have our full bipartisan support. The second thing is that I think the Commonwealth can do is play a stronger leadership role in palliative care. As part of our election policies, Labor committed to lead a new national effort in advanced care directives. Properly done on a family conversation model, they ensure that Australians received the best care possible, but that it is care that they have agreed to and it is in the best interest as they die. But I think the Commonwealth can and should play an even stronger role than that, because only the Commonwealth can address the challenges our palliative care system faces. I do not see palliative care as simply part of the aged care system. It is a fundamental part of our healthcare system in the same way that other subacute and community-based healthcare services are. It needs to be funded, understood and integrated as such. In the truth, end-of-life care in Australia is not structured around people who are dying or their families and friends. Instead, it is fragmented across funders, the Commonwealth, states and providers, primary care providers, aged care providers and hospitals. That fragmentation undermines care for Australians who are at the end of their lives. And again, I want to quote Stephen Duckett and Hal Sverenson's report. In that last year of life, many experience a disconnected, confusing and distressing array of services, interventions and relationships with health professionals. Of course, palliative care is a shared responsibility. I'm not suggesting that the Commonwealth should go it alone. But I do think that only the national government can lead a process that improves palliative care for all Australians. It does take national leadership in partnership with patients, with families, funders and providers to improve the quality of care at the end of our lives and expand access. Again, anything that the Minister does in this space will of course have our bipartisan support. And of course, Labor will continue to refine our own policies ahead of the election. I am grateful for Palliative Care Australia's participation in our National Health Policy Summit in March. I just want to conclude my remarks on the theme of this year's Palliative Care Week, which is You Matter and Your Care Matters. palliative care can and does make a difference. It is an excellent message, and I hope that millions of Australians hear it this week. But as I've discussed today, we face another challenge, and that is to make a difference in our palliative care system itself. More people need to formally express their wishes for their end-of-life care. More people need to spend their final days in their preferred settings, surrounded by people who love them. And more people deserve access to palliative care that is centred around their needs. I look forward to working with you to making that a reality. Thank you.